Hey guys, welcome back to Fresh Living.
Once again, outside enjoying the sun.
Yeah, it's gorgeous. Well, we're talking now about an emergency that some people don't even know is going on inside their body. May is National Stroke Awareness Month, so I went to Intermountain Medical Center to check out their award-winning stroke program to see how they're helping patients, both those that have already had a stroke and people before they have one. Pam was your typical busy woman trying to juggle job, family, and life.
10 years ago, I was a middle management for a Fortune 500 company. I was serving on 5 boards. I was an active mother. I had an 11-year-old and a 16-year-old still at home. And, doing it all.
Little did she know she had a condition that was a ticking time bomb that would rock her world.
Then I woke up, the alarm went off, and I got up to turn it off, and it felt like a poker went straight through my eye.
Pam thought it was a migraine and went back to bed. But then a confusing moment made her think that this was more than just a bad headache.
And I sat there, and I saw the thing to say phone, and I had the phone in this hand, and I go, okay, here's my number, here's my phone. I didn't know what to do.
She immediately had her husband take her to the hospital, recognizing she was likely having a stroke.
A stroke is a circulation problem to the brain, similar to what a heart attack is to the heart.
And when a patient is having a stroke, time is of the essence.
After about 30 to 60 seconds without oxygen, the brain cells will begin to lose function. After about within 3 hours, that can become permanent.
With such a small window for treatment, it's crucial that family and friends recognize the symptoms. The stroke team uses the acronym FAST to help people remember.
The one is face. Look to see if there's a droop on one side of the face. That could be a sign of a stroke. The second is A, which stands for arms. You want to look to see if one arm is weaker than the other one. The third part is S, which stands for speech. You want to see if the speech is garbled or if they're not making any sense or can't get the words out. And the final one is T, and that stands for time. Time is brain and is absolutely essential to get to the hospital as soon as possible.
Once it's determined a patient is having a stroke, the nurse will call a stroke code. 5 to 10 people of the Intermountain Medical Center's stroke team will immediately come to that patient's room.
There would be a neurologist, there would be the pharmacist who is there specifically to help provide the correct dose of medications.
Most strokes are caused by a blood clot that gets stuck in the brain. First, they'll get a CT scan to determine if it's a blood clot or a broken artery. Then a pharmacist will give the patient a medication called TPA, which can make a big difference in how the patient is affected in the long term.
So if it's a stroke that's caused by a blood clot going to the brain, it's going to help break up that clot and restore blood flow.
For Pam, it was discovered that she had a hole in her heart, which caused the blood clot to hit her brain. She was in the hospital for 8 days, and her road to recovery started with fixing the initial problem.
And then I had to go back for the surgery to seal the heart. And then the rehab began. And really rehab, where it was really intense and called rehab, was almost 4 years.
Rehab, which included a pack of specialists to help her relearn how to hear, walk, and even see straight. Even though it's been years, Pam still has lingering side effects from her stroke.
I hear all the noises. I hear that camera running, the fan. I cannot, my brain doesn't filter that out for me. I have to do that physically.
But she's grateful she recognized the symptoms because it ultimately saved her life.
If I would have gone to bed thinking it was the flu, my life, I wouldn't be sitting here. I wouldn't look like I look today.
Well, Intermountain Medical Center in Murray is the flagship hospital for Intermountain Healthcare, and they treat more stroke patients each year than any other hospital in our state. Also, it's good to know that stroke specialists are there 24 hours a day, 7 days a week to help you when you need them. To find out more, you can go to intermountainhealthcare.org.